Waking up with a dry mouth might seem like a small, even trivial discomfort, something you might brush off and forget about by the time you reach the kitchen in the morning. But the truth is, your body is sending you a signal, a message that something in your health, your habits, or your daily routine deserves attention. Dry mouth, or xerostomia as doctors call it, is more than just an inconvenience. It is often a subtle early warning that your body needs care and that your internal systems are out of balance. When we sleep, our bodies go through a natural restoration process, repairing tissues, regulating hormones, and restoring energy. Saliva, though often overlooked, plays a critical role in this process. It keeps our mouth and throat moist, helps in digestion, neutralizes acids, and protects against bacteria. If you wake up and your mouth feels parched, it means the balance of this vital fluid has been disrupted. Understanding why this happens can help you take practical steps to safeguard your health. One of the most common reasons people wake up with a dry mouth is simple dehydration. Even if you drank water during the day, the natural process of breathing and sweating during sleep gradually removes moisture from your body. If your hydration levels are not adequate, your salivary glands cannot produce enough saliva to keep your mouth moist throughout the night. This is why maintaining consistent water intake during the day is crucial, not just for thirst, but for the many processes that rely on water, including digestion, circulation, and cellular repair. It's also worth noting that certain medications can contribute to dry mouth. Many commonly prescribed drugs, from antihistamines and decongestants to some antidepressants and blood pressure medications, have side effects that reduce saliva production. For people taking these medications, waking up with a dry mouth is not just a coincidence, but a predictable reaction of the body to chemical changes that affect the salivary glands. Another factor that plays a significant role in dry mouth is breathing. While it might sound simple, the way we breathe during sleep can dramatically affect oral moisture. Mouth breathing, often caused by nasal congestion, allergies, or sleep apnea, dries out the mouth rapidly. Even minor snoring can pull moisture from the oral tissues, leaving your tongue, lips, and throat dry by morning. This is why paying attention to sleep posture, practicing nasal breathing exercises, and addressing any underlying breathing difficulties can make a real difference. Simple tools such as using a humidifier in the bedroom can also help maintain a healthy level of moisture in the air, preventing excessive dryness while you sleep. It's important to recognize that dry mouth can also indicate underlying health issues. Persistent dry mouth is sometimes linked to conditions such as diabetes, where high blood sugar affects fluid balance, or autoimmune diseases like Sjogren's syndrome, where the immune system attacks salivary glands. It may even be a symptom of sleep disorders that disrupt normal restorative sleep cycles. Ignoring these signals can allow small problems to escalate into larger health concerns, so listening to your body and observing patterns is essential. Lifestyle choices also contribute significantly to the occurrence of dry mouth. Consuming alcohol or caffeinated beverages in the evening, smoking, or eating very salty foods before bed can all reduce the moisture in your mouth overnight. Even habits that seem harmless, like staying up late or sleeping in a warm, dry room, can exacerbate the problem. On the other hand, mindful practices, drinking water throughout the day, choosing balanced meals, limiting dehydrating substances, and creating a sleep-friendly environment can help maintain oral moisture naturally. The key takeaway is that waking up with a dry mouth is not something to dismiss lightly. It is your body's way of asking for attention, whether it's more hydration, lifestyle adjustments, or a checkup with a healthcare professional. By understanding the causes and being proactive, you can prevent complications like dental issues, gum disease, or chronic discomfort. Your body communicates in subtle ways, and dry mouth is one of those early signals that should guide you toward better self-care. Recognizing and responding to these signals is a step toward improved overall health, ensuring that each morning starts with energy, comfort, and a well-hydrated body ready to support all your daily activities. When we talk about waking up with a dry mouth, one of the first and most effective solutions lies in something as simple and as powerful as water. Hydration is fundamental to every system in the body, yet so many of us underestimate its importance. Every cell, every tissue, and every organ depends on water to function properly. From the brain to the heart, kidneys to muscles, water is the vehicle that carries nutrients, removes waste, and regulates temperature. When we fail to drink enough, it is not just our mouths that suffer. Our entire body begins to signal distress in subtle ways. Dry mouth upon waking is one of the clearest messages, but fatigue, headaches, poor concentration, and even digestive issues are all connected to inadequate hydration. Many people make the mistake of thinking that drinking water only when they feel thirsty is enough. In reality, thirst is a delayed warning. By the time your body tells you it's thirsty, it is already experiencing mild dehydration. That's why maintaining a consistent water intake throughout the day is critical. Experts often recommend drinking at least 8 glasses of water daily, but the exact amount depends on body size, activity level, and environmental conditions. Those who exercise heavily, live in hot climates, or consume diuretics like caffeine will need more. Incorporating water-rich foods, such as fruits and vegetables, can also contribute to overall hydration while providing essential vitamins, minerals, and fiber. Hydration doesn't just affect your mouth, it influences saliva production, digestion, and even your sleep quality. Saliva plays an important protective role, and when your body lacks water, it cannot maintain an optimal balance. This leads to a dry mouth, increased acidity in the oral environment, and a higher risk of cavities and gum disease. When your body is well hydrated, saliva flows freely, washing away bacteria and supporting the health of teeth and gums. Additionally, proper hydration helps maintain circulation and supports the removal of toxins through the kidneys and liver, which ultimately improves your energy and mental clarity. The timing of hydration is equally important. Drinking a large amount of water immediately before bed might not be ideal, as it can interrupt sleep with frequent trips to the bathroom. Instead, it's more effective to hydrate steadily throughout the day and include small amounts of water in the evening, maintaining balance without overloading the bladder. Starting your morning with a glass of water is also highly beneficial. It kickstarts the body's metabolic processes, replenishes fluids lost overnight, and gently wakes up your digestive system. Another aspect to consider is the type of fluids we consume. Water should be the primary source, while sugary drinks, sodas, and even excessive caffeinated beverages can actually dehydrate the body. Herbal teas, naturally flavored waters, and coconut water are excellent alternatives that support hydration while providing additional health benefits. Simple habits, like keeping a water bottle on your desk, tracking your intake, or using hydration reminders on your phone, can significantly improve your consistency and help you listen to your body's needs. Hydration also intersects with overall lifestyle choices. Alcohol, for instance, can dramatically dry out the mouth and deplete essential fluids. Smoking has a similar effect, reducing saliva production and increasing the risk of oral health problems. Even daily stress can influence hydration indirectly as it affects metabolism, hormone balance, and sometimes appetite and thirst awareness. By adopting mindful hydration practices, you are not only preventing dry mouth, but also supporting your immune system, cognitive function, and cardiovascular health. Ultimately, consistent hydration is more than a daily routine. It is a form of proactive healthcare. Waking up with a dry mouth is your body's way of reminding you that something as basic as water has been neglected. By prioritizing hydration, you are respecting the signals your body sends, protecting your oral health, supporting systemic functions, and improving your overall energy and well-being. It is a simple, yet profoundly effective way to start caring for yourself daily, turning a small habit into a cornerstone of a healthier life. When it comes to waking up with a dry mouth, one factor that is often overlooked is the way we breathe while we sleep. Many people assume that breathing is automatic and that it does not require attention. But the truth is that the manner in which we breathe profoundly impacts our oral health, hydration, and overall wellness. Sleeping is supposed to be a restorative period, allowing the body to repair tissues, regulate hormones, and replenish energy. But if we breathe predominantly through our mouths, if we snore, or if our airways are partially blocked, the natural flow of moisture in our mouths is disrupted, leaving us parched by the time the alarm goes off. Understanding the connection between sleep and breathing is essential for addressing dry mouth and optimizing nighttime recovery. One of the most common causes of nighttime dry mouth is mouth breathing. For many people, nasal congestion caused by allergies, sinus infections, or even a deviated septum can force the body to rely on oral breathing. Mouth breathing increases airflow over the tongue and gums, which dries out the oral tissues. Even mild snoring, which is often accompanied by partial airway obstruction, can exacerbate this dryness. Over time, this not only leads to the uncomfortable sensation of waking up with a dry mouth, but can also increase the risk of cavities, gum disease, and throat irritation. Addressing the root cause of mouth breathing is therefore a critical step in improving both sleep quality and oral health. Sleep posture also plays a significant role. Sleeping flat on your back may encourage your mouth to open during the night, particularly if nasal passages are restricted. Elevating the head slightly with a pillow or adjustable bed can help keep the airways open and encourage nasal breathing, reducing the likelihood of dry mouth. Similarly, side sleeping can sometimes prevent the tongue from falling back and partially blocking the airway, which can also decrease dryness and snoring. Small adjustments in how we position ourselves during sleep can have a surprisingly large impact on both comfort and overall health. Environmental factors further influence nighttime dryness. Many bedrooms are heated or air-conditioned, which can reduce humidity levels in the air. Low humidity draws moisture out of the mouth and throat, leaving you feeling parched in the morning. Using a humidifier near your bed, especially during dry seasons, can restore moisture to the air and help maintain hydration while you sleep. Simple changes such as this often make a noticeable difference, and they support not only oral health but also skin, respiratory comfort, and general sleep quality. Practicing breathing exercises during the day can also help train the body to breathe through the nose more consistently. Techniques such as slow diaphragmatic breathing or alternate nostril breathing can improve airflow, strengthen the respiratory muscles, and reduce reliance on mouth breathing during sleep. Over time, these exercises support a more natural, restorative breathing pattern at night, helping to prevent the dryness and discomfort that so many experience in the morning. Underlying medical conditions should not be overlooked. Sleep apnea, for example, is a condition in which the airway becomes partially or fully blocked during sleep, causing interruptions in breathing. This often leads to heavy snoring, mouth breathing, and consequently, dry mouth upon waking. Similarly, chronic nasal congestion or sinus issues can force oral breathing and contribute to dehydration of the oral tissues. If dry mouth persists despite hydration and environmental adjustments, it may be a signal to consult a healthcare professional to rule out these conditions. Addressing the root cause can improve not only oral comfort but also overall sleep quality and long-term health. Ultimately, paying attention to how we breathe while we sleep is about more than preventing dry mouth. It is about respecting the body's need for restorative rest. When nasal passages are clear, breathing is smooth, and the sleep environment supports natural moisture, the body can repair itself, hormones can balance, and energy levels improve. Dry mouth is a gentle reminder from your body, urging you to consider not just what you consume or drink, but how you rest. By combining awareness of sleep posture, environmental factors, and healthy breathing habits, we can ensure that our nights are as restorative as they are restful, waking up refreshed, hydrated, and ready for the day ahead. Another critical factor that affects whether you wake up with a dry mouth is your diet and overall lifestyle. What we eat and drink during the day, as well as certain daily habits, have a direct impact on hydration, saliva production, and oral health. Many people overlook how much influence these choices have on the body's natural processes while they sleep. Dry mouth is not always caused by a single factor. Often it is the combination of what we consume, our routines, and how our body responds to them that leads to discomfort in the morning. Understanding and adjusting these habits can make a profound difference. Caffeine and alcohol are two of the most common dietary contributors to dry mouth. Caffeine, found in coffee, tea, chocolate, and some soft drinks, acts as a mild diuretic, increasing fluid loss through urine. When consumed in excess, especially in the afternoon or evening, it can subtly dehydrate the body, reducing saliva production and leaving the mouth dry overnight. Alcohol has a similar effect. It not only dehydrates the body but also relaxes the muscles, which can encourage mouth breathing during sleep, further drying the oral tissues. Reducing late-day caffeine and alcohol intake, or balancing them with water, can help restore the body's natural moisture balance. Salt and highly processed foods also play a role. A diet high in sodium can draw water out of cells, creating systemic dehydration even if your overall fluid intake seems adequate. This imbalance can leave your mouth feeling dry and sticky in the morning. On the other hand, incorporating foods with naturally high water content, such as cucumbers, watermelon, oranges, and leafy greens, can help maintain hydration while also providing essential vitamins, minerals, and antioxidants that support overall health. Even small changes like replacing salty snacks with fresh fruit or drinking a glass of water alongside meals can make a noticeable difference in how your mouth feels upon waking. Smoking and vaping are lifestyle choices that significantly affect oral moisture. Nicotine and other chemicals in tobacco products reduce saliva production and irritate the oral tissues, which can lead to chronic dry mouth, bad breath, and an increased risk of gum disease. Beyond oral health, these habits affect cardiovascular, respiratory, and overall systemic health, so addressing them has multiple benefits. Quitting smoking or limiting exposure to secondhand smoke can dramatically improve hydration in the mouth, protect teeth and gums, and enhance overall well-being. Even stress and irregular routines can indirectly affect dryness. High stress levels increase cortisol production, which can impact saliva flow and fluid balance in the body. Irregular sleep patterns or late-night snacking may also disrupt natural hydration cycles, further contributing to morning dryness. Mindful practices such as reducing stress through meditation, gentle exercise, or evening wind-down routines can help regulate these bodily systems, allowing the mouth and body to maintain better moisture balance overnight. It is also worth considering the timing and combination of food and fluid intake. Heavy meals late at night, particularly those high in protein or salt, may demand more water for digestion, leaving less available to maintain oral moisture during sleep. Similarly, hydrating steadily throughout the day rather than consuming large amounts of fluid at once ensures that the body can maintain proper hydration levels continuously, supporting saliva production and overall systemic health. The connection between diet, lifestyle, and dry mouth highlights an important principle. Our daily choices directly impact how our body functions during sleep. When we consciously choose foods and habits that promote hydration and oral health, we empower our body to work efficiently, repair itself, and restore energy naturally. Conversely, ignoring these factors may result in repeated discomfort, oral health issues, and even broader health consequences over time. By understanding the influence of diet and lifestyle, we can take practical steps to reduce dry mouth and support overall health. Small adjustments, drinking water consistently, moderating caffeine and alcohol, choosing hydrating foods, avoiding smoking, and managing stress, accumulate over time to create a healthier internal environment. These changes not only improve how your mouth feels in the morning, but also contribute to better digestion, stronger immunity, and a greater sense of well-being throughout the day. Another important aspect to consider when discussing dry mouth is oral health and preventive care. While it may seem like dry mouth is only about discomfort, the truth is that it has a profound impact on the overall health of your teeth, gums, and mouth. Saliva is not just water, it is a complex fluid that contains enzymes, proteins, and minerals that protect your oral tissues from bacteria, neutralize acids, and help repair tiny damages in the mouth. When saliva production is insufficient, the natural defense system of your mouth is weakened, making it more vulnerable to cavities, gum disease, bad breath, and even infections. This is why taking proactive steps in oral health care is essential, especially if you frequently wake up with a dry mouth. Daily oral hygiene practices are the first line of defense. Brushing your teeth at least twice a day with fluoride toothpaste helps remove plaque and food particles that contribute to bacterial growth. Flossing is equally important because it reaches areas between the teeth where a toothbrush cannot, preventing gum inflammation and cavities. Using an alcohol-free mouthwash can also support oral moisture while reducing bacterial buildup. For those who wake up with persistent dryness, saliva-stimulating products such as sugar-free gums or lozenges can encourage the body to produce more saliva, keeping the mouth moist and protecting oral tissues throughout the day. Regular dental checkups are another critical component of preventive care. Visiting the dentist every 6 months, or as recommended by your dental professional, allows early detection of issues that might be worsened by dry mouth. Cavities, gum disease, or enamel erosion can progress quietly until they cause significant discomfort or require extensive treatment. By addressing problems early, you not only protect your oral health, but also prevent additional stress on your body, as chronic oral issues can influence other systems, including heart health and digestion. It is also important to recognize the interplay between oral health and lifestyle factors. Smoking, alcohol, caffeine, and sugary foods not only contribute to dry mouth, but also directly affect teeth and gums. Over time, these habits increase the risk of periodontal disease, tooth decay, and enamel wear. By minimizing these behaviors and replacing them with positive habits, such as drinking water, eating hydrating foods, and using protective oral care products, you strengthen both your saliva's protective role and your overall oral health. Hydration and diet, which we discussed earlier, complement oral hygiene. When the body is well hydrated, saliva production improves naturally, allowing the mouth to self-cleanse and maintain a healthy microbial balance. Foods that contain natural sugars and acids like fruits should be consumed with care, and it is wise to rinse the mouth with water after eating or drinking anything that could promote bacterial growth. Small, mindful habits like this have a cumulative effect, creating a strong defense against the consequences of dry mouth. Additionally, preventive care involves being aware of underlying medical conditions that may impact oral health. Conditions such as diabetes, autoimmune disorders, or medication side effects can increase the likelihood of dry mouth and oral complications. Being proactive in monitoring your health and sharing relevant information with your dentist or healthcare provider ensures that potential problems are managed before they become serious. Your mouth is a reflection of your overall health, and maintaining it carefully supports your body as a whole. Finally, it is essential to view oral health not as a separate concern, but as part of a holistic approach to well-being. By integrating daily hygiene practices, regular dental visits, healthy dietary choices, hydration, and mindful lifestyle adjustments, you create an environment where saliva can perform its natural protective functions. This reduces the discomfort of dry mouth, prevents dental problems, and supports broader health outcomes, including immune function, digestion, and even sleep quality. Caring for your oral health is more than maintaining a bright smile. It is about respecting your body's signals and taking preventive action. Dry mouth is a warning, and how you respond can either reinforce wellness or allow complications to develop. By embracing consistent oral care and preventive practices, you are empowering your body to function optimally, starting from the moment you wake up and continuing throughout your day. While many instances of dry mouth can be addressed with hydration, lifestyle changes, and oral care, there are times when it is important to recognize that your body may be signaling something more serious. Waking up with a dry mouth occasionally might not be alarming, but persistent or severe dryness should not be ignored. Your body communicates through subtle signs, and dry mouth is one of them, a gentle reminder that something may need attention beyond everyday habits. Understanding when to consult a healthcare professional can make a profound difference in both your oral health and overall well-being. One of the most important reasons to see a doctor is when dry mouth is accompanied by other unusual symptoms. If you notice increased thirst, frequent urination, unexplained fatigue, or sudden changes in weight, it could be a sign of underlying conditions such as diabetes. High blood sugar affects fluid balance and can reduce saliva production, leaving your mouth dry even if you are drinking water consistently. Early detection of such conditions allows for timely intervention, better management, and prevention of complications that can affect multiple systems in the body. Chronic dry mouth may also indicate autoimmune disorders, such as Sjogren's syndrome, where the immune system attacks the salivary glands. Symptoms often include persistent dryness in the mouth and eyes, difficulty swallowing, and increased susceptibility to oral infections. These conditions require professional evaluation and long-term management, including medications or therapies that support saliva production and overall health. Ignoring these signals can result in ongoing discomfort and more serious complications down the line, making timely medical consultation essential. Sleep-related issues are another area where a doctor's guidance is valuable. Conditions like sleep apnea or chronic nasal obstruction can contribute to mouth breathing, snoring, and dry mouth. Left untreated, sleep apnea can have serious consequences, including high blood pressure, cardiovascular strain, and daytime fatigue. Consulting a healthcare provider, undergoing proper evaluation, and following prescribed treatments, such as CPAP devices, nasal strips, or surgical interventions, can not only alleviate dry mouth but also improve sleep quality and overall health. Medication is another factor to consider. Many commonly prescribed drugs, including antihistamines, decongestants, blood pressure medications, and antidepressants, can reduce saliva production. If you are experiencing persistent dryness, a doctor or pharmacist can review your medications, suggest alternatives, or provide guidance on mitigating side effects. Sometimes a small adjustment in timing, dosage, or drug choice can significantly improve your comfort and oral moisture levels. It is also important to remember that dry mouth can increase the risk of oral infections, tooth decay, and gum disease. If you notice persistent bad breath, a burning sensation in the mouth, or signs of gum irritation, consulting a dentist or healthcare provider ensures that these issues are addressed early. Preventive care combined with professional guidance helps maintain both oral and systemic health, allowing you to avoid complications that could otherwise develop silently over time. Listening to your body is a skill that pays dividends for overall wellness. Dry mouth is not just a minor inconvenience. It is an important clue from your body that something needs attention. By taking this signal seriously, tracking your symptoms, and seeking professional advice when necessary, you empower yourself to address underlying causes rather than simply masking the symptom. This proactive approach ensures that your body functions optimally, reduces the risk of long-term health issues, and